Hi there. Thank you for your interest in the diabetes prevention program. My name is Jill, and I'm one of the lifestyle coaches for this program. And I'm just going to give you a quick overview of what makes this program so unique and different from other programs you may be aware of, and also what makes this program so effective. So we're going to just go through a really quick slideshow that will kind of let you know what this program is all about. So, why should you be concerned about diabetes? If you have clicked on this link, then most likely you already have some concerns. But let's take a quick peek at the statistics. In the United States, there are about 30 million Americans with diabetes, but that's really just the tip of the iceberg. There are approximately 84 million Americans with prediabetes. So that turns out to be about 1 in 3 Americans. And the majority of those people are completely unaware that they are at risk for type 2 diabetes. What is prediabetes and how is it diagnosed? It's a condition in which an individual's blood sugar levels are higher than normal, but not high enough for a diagnosis of type 2 diabetes. So for instance, if you've been to your doctor and had some blood work done, you may have found out that your A1C level is between 5.7 and 6.4. That would be considered prediabetes, or a fasting blood glucose level between 100 and 125. If you have not had blood work done recently, or you're not sure what those numbers might look like, you could still be at risk for type 2 diabetes. And there are a number of risk factors that are listed here, but you can also click on a link below to take a quick risk test that will let you know if you are in that category of at risk for type 2 diabetes. If you think that you're at risk, what can you do about it? So the National Diabetes Prevention Program offers a free lifestyle change program to prevent or delay type 2 diabetes. So throughout this program, participants learn to make lasting lifestyle changes, such as eating healthier, adding physical activity into their daily routine, and improving their coping skills. These are all things that can reduce your risk for type 2 diabetes. And research has shown that people that go through this program have lost between 5 to 7% of their body weight, added in 150 minutes of exercise per week, and these outcomes have cut their risk of developing type 2 diabetes by 58%. And that actually goes up to 71% for people 60 and older. So here's a quick overview of the program in a nutshell. It is a free 12-month lifestyle change program. So as a participant, you would be provided with lessons, handouts, and other resources to help you make healthy changes. You would have access to a lifestyle coach like myself, specifically trained to lead the program, to help you learn new skills, encourage you to set and meet goals of your own choosing, and to keep you motivated throughout the program. You choose which goals to set because you're your own expert, and you'll be immersed in a support group of people with similar goals and challenges. You'll share ideas, celebrate successes, and work together to overcome obstacles. So that's kind of a quick overview of what the program looks like, but an even better way that I like to describe the program is I'll ask you to close your eyes for just a moment. And I want you to envision a nice juicy red apple and also a bag of chips. So if someone were to ask you which one is a healthier choice, I'm assuming you would most likely choose the apple. We all know that an apple is typically a healthier choice than a bag of chips. But let's say you were to go to a sandwich shop and they said, oh, your sandwich comes with a side. Would you like a bag of chips or an apple? Which one would you choose? So for many of us, we might choose that bag of chips. So it's not always about the head knowledge piece of things, knowing which one is a healthier choice. It's about how do we more consistently make those healthier choices? And that's really what this program is designed to do. Is this program right for you? Like I mentioned before, the Diabetes Prevention Program is a year-long program, and I'll explain why in a moment, but what does that look like? So for the first 6 months, groups will typically meet 3 times per month. on the same day, the same time every week. So about 3 weeks out of each month. And for the second 6 months, groups typically meet only once per month. So the first 6 months typically go by pretty quickly. You'll be meeting on a regular basis, and then before you know it, you're only meeting once per month. So that comes out to be a total of 24 meetings in a year, which is, and each meeting is about an hour. So that's a total of 24 hours of your life, one day, to really have some effective, lasting changes. What is the diabetes prevention program not? It is not a strict prescribed diet or exercise plan. It's not a program that dictates exactly how many calories, carbs, fat grams, et cetera, you are allowed. And it's not an all or nothing program. Like I mentioned before, you get to choose the changes that you want to make. And it's not as though if you're struggling with making those changes, you're going to be booted out of the program. You know, the idea is that we take that time to face those challenges, to come up with solutions together, to really kind of create that lasting lifestyle change that you choose. Why a full year? So during this year, you'll explore your current beliefs and habits. So a big part of this program is just figuring out, where are we? What are the choices that I'm making on a routine basis? And how can I tweak those choices to make them healthier and to improve my overall well-being? So you have the opportunity to learn new information and gradually incorporate new routines and habits of your own choosing. Over time, as we talk about, these routines will become as automatic as brushing your teeth twice a day or grocery shopping on Sundays. Healthy choices will just become the new rhythm of your life. Also, the other thing that we notice with the program being a full year is it gives you the opportunity to have some failures and to see how you're going to face those failures. You know, throughout the year, it's not always smooth sailing. So, you know, we have those ups and downs in our day-to-day life, and it allows us to kind of figure out, okay, what can we do when those ups and downs come throughout the rest of our lives to continue to choose those habits and routines that will help us to be our best. What's expected from you if you participate in this free program? So as a participant, we ask that people try to attend as many sessions as possible, knowing that, you know, occasionally there might be a session you need to miss. Weigh yourself prior to each session and send that current weight to your coach. Keep track of your minutes of physical activity and share that information with your coach. Maintain a food log and share that with your coach as well. And participate in sessions and support other members of your group. We'll also ask that you be open to ideas and suggestions from other group members. Be willing to try something new, and like I mentioned before, possibly fail at it. Acknowledge that there will be good days and bad days, sometimes good weeks, bad weeks, or months, but both are an opportunity to learn about yourself. And be honest with your coach about any challenges you encounter so you can work through them together. What can you expect from your coach? Your coach will be respectful of your time and start and end sessions in a timely manner. So like I mentioned, those sessions are typically about an hour, sometimes a little bit less, but we will always try to be respectful of your time. Check in with you prior to each session. So your coach will check in with you with an email, ask for your weight, your minutes of physical activity, and a copy of your food log. Your coach will hold you accountable to your goals that you have set. Your coach will also keep information that you share confidential and will facilitate discussions to make the program fun and engaging. What do you need to get started? So you'll need access to a computer or tablet or phone with video and audio capabilities to participate in our Zoom sessions. And if that's something you've never done before, your coach can walk you through that process. I promise, as someone who is technologically challenged, it's very easy. You'll also need a scale for those regular weigh-ins and pen and paper. How do you register for this program? So you will see that there is a link from this webpage to enroll. Simply click on the enroll button. You'll fill out a quick online form, indicate the day and time of the class that best fits your schedule, and you'll be ready to go. So that's the program in a super quick overview. there really is a lot of magic that happens throughout the year together. So we encourage you to reach out to us and ask more questions if you have them, or to go through the risk test to find out if you are at risk. But I always like to end each session with a quote, so I will do the same here. The quote of the day is, "Sometimes the smallest step in the right direction ends up being the biggest step of your life. Tiptoe if you must, but take the step." Thanks so much.